Your doctor or mental health provider may suggest medications or behavior therapy, or both, to treat phobias. Most adults don't get better on their own and may require some help with treatment. The goal of phobia treatment is to reduce your anxiety and fear and to help you better manage your reactions to the object or situation that causes them. Medications include beta blockers. These medications work by blocking the stimulating effects of adrenaline on your body, such as increased heart rate, elevated blood pressure, pounding heart, and shaking voice and limbs. Beta blockers can be very effective for people who have severe stage fright. Antidepressants. The most commonly used antidepressants are selective serotonin reuptake inhibitors, SSRIs. These medications act on chemical serotonin, a neurotransmitter in your brain that's believed to influence mood. Sedatives. Medication called benzodiazepines help you relax by reducing the amount of anxiety that you feel. Sedatives need to be used with caution because they can be addictive and should be avoided if you have a history of alcohol or drug dependence. Behavior therapy. Desensitization or exposure therapy focuses on changing your response to the object or situation that you fear. Gradual, repeated exposure to the cause of your phobia may help you learn to conquer your anxiety. For example, if you're afraid of flying, your therapy may progress from simply thinking about your flying to looking at pictures of airplanes, to going to an airport, to sitting on an airplane, and finally, taking a flight. Cognitive behavioral therapy is a more comprehensive form of therapy. It involves working with a therapist to learn ways to view and cope with a feared object or a situation differently. You learn alternative beliefs about your fears and the impact they have in your life. There is special emphasis on learning to develop a sense of mastery and control of your thoughts and feelings. So what have we learned today? The definition of a phobia is the unrelenting fear of a situation, activity, or thing that causes one to want to avoid it. The three classes of phobias are specific phobias, social phobias, and agoraphobia. Women tend to be twice as likely to suffer from a phobia compared to men. Agoraphobia often coexists with panic disorders. Assessment of phobias often includes questions by a trained professional that explore the symptoms being experienced, a medical interview, and a physical examination. Phobias are often treated using desensitization, cognitive behavioral therapy, and/or medications. The groups of medications doctors tend to choose from when treating a phobia include selective serotonin reuptake inhibitors, beta blockers, and occasionally benzodiazepines. Phobia sufferers sometimes cope with their fears by talking about it, refraining from avoiding situations they find stressful, visualization, and making positive self-statements. If you're living in fear because of your phobia, don't worry, there's hope. You can overcome phobias with the right treatment and self-help programs. Thanks for watching this segment on phobias. I'm Jake Dore, signing off.
So what can an ordinary person like you or me do in these kind of situations?
Rearrange your CD collection. Take a deep breath and count to 10.
Call a long-lost relative.
Create a superhero identity for the night.
Ask a stranger for an autograph.
Play with your dog.
Oh.
Have a barbecue in the living room.
Ride a bicycle with no hands.
Confess your blunders to a friend.
Practice the art of siesta.
Take a mental vacation. Use better priorities.
Learn a martial art.
Appreciate the weather, rain or shine.
Call your mum.
know there is a fear of long words? And do you know the name for it?
Hippopotamonstроsis.
Phobia.
Not only do you have an issue, you can't even name it.